All right, so let's look at ourselves as humans. We are made of emotions, free will, thinking, and whatnot. But what should really strike you is the complexity of our body. Now, what makes our body so complex? It's organs, it's systems, it's amazing. And we all know that the heart is the core. It is what regulates, makes us function every day. It's that beautiful, beautiful, beautiful shade of red. But how about when it's not working? What if it's not that shade of red? How do we know when we could be on the verge of death or what we're experiencing is normal? So let me tell you about a test you could do, an electrocardiogram. According to Johns Hopkins Medicine, it is one of the simplest and fastest tests to use to evaluate the heart. It measures the electrical signal and it is measured, interpreted, and printed out for medical professionals. And I will be going over the heart connection system, ECG setups, rhythm strips, sinus rhythms, arrhythmias, and whatnot. Now, please note that EKG and ECG mean the same thing. It's just British versus American spelling. So let's start. Now, we have the heart's electrical system, and to understand EKGs, we have to understand the electrical system first. Let's start. So first, understand that all electrical signals go from right to left, and it all begins when the SA sinus atrial node is stimulated. Then the signal moves down to the atrioventricular node, which is then stimulated, and then it propagates up to the AV bundle. Then it is propagates up into the Purkinje fibers, where the signal will be sent to the left side of the heart. And Stanford Medicine on this slide provides a clear image of the heart's electrical system on the right. And if you follow the arrows, the left. If you follow the system, you can see how it flows. And on the right, I provided a PQRST wave. A PQRST wave, which we will get into next. So here is a common ECG setup in a medical setting. You have the nurse monitoring the machine, and you have the patient with different leads. Now, leads are described as with the letter V, as in V1 through 12, and each lead takes those signals in different locations, put them into an EKG reading. In this presentation, we're only doing one lead. But thoracic key explains the different positioning for the leads, as different places detect the voltages of different currents conducted in the different locations, and abnormalities in these locations may suggest damage to certain parts of the heart. So they go all around the chest, they go on the legs and on the arms as the leads go there. So now that we know how to place leads in the physiology of the heart, we can move on to the basics of an EKG strip. Now notice how an EKG strip is composed of small and big boxes and hash marks, and each small box is 0.04 seconds, and each big box is composed of 5 boxes, so meaning that each big box is 0.2 seconds. Now if you can see on the top side of the heart, we have hash marks, which are 3 hash marks. And between 2 hash marks, it is 3 seconds, meaning that the whole strip itself is 6 seconds. This is what the average EKG strip reads for. Moving on. Now, it's important to know the time frame and basics for an EKG strip because it will greatly assist you in reading different types of rhythms. I've been reading EKG strips for the past 6 months, and I feel like I am qualified to share this with you. So moving on, we have normal sinus rhythms. On this screen, I provided to you a normal EKG portrayal of a sinus rhythm, which is what everybody has when they are healthy and their heart is in good shape. So in each colored portion of this rhythm means the different parts of the heart's process and beating. So let's talk about it. The P wave describes an SA node depolarization, causing a signal to be sent through the atrium, and it goes into Bachman's bundle, and then depolarizes the left atrium. The QRS complex is perhaps the most important part of an PQRST wave, as it features the ventricles depolarizing as the beginning of systole and ventricular contraction. Now, according to medicinenet.com, systole means the time period when the heart is contracting, specifically when the left ventricle contracts, as explained above. The ST segment is the ventricles contracting with no electricity through them, and the T wave is basically the rest, relaxation of the cycle, and it features post-ventricular depolarization. Now, to determine heart rate, we have different methods, such as the 6-second method, big box, and little box method. Personally, I would do the 6-second method because it's the most easiest to use and the less time consuming. The other two are very tedious, and I would not recommend them. But note that all of these are for basic analysis, not specific heart rates. It's not going to give you anything specific. It's just an average and about. So now that we've covered the basics, we can finally start to read different rhythms. Here, I've provided to you a sinus arrhythmia. This is a variation of a sinus rhythm, the only key difference being that the heart rate fluctuates if we were to use the the heart rate methods. We would see that the heart rate fluctuates. It's not the same. Then we have sinus bradycardia, which is effectively the heart rate under 60 beats per minute, but it's still normal PQRST wave. Sinus tachycardia is when heart rate is above 100, and it's usually due to an increased sympathetic response as pain, fever, increased O2 demand, and whatnot. Atrial flutter, it features sawtooth waves, and it creates a loop. It's just a bunch of electrical signals being sent over and over and over again, and it's not good. Going a little more crazy, we have VTAC, ventricular tachycardia. The heart rate's greater than 150, and the ventricles are going literally crazy. Systole is your flat line, you're dead, you're almost near death. It is a line. It's probably the most notable one that you can probably think of as you've seen on shows. Here I've described the most common types once again, and these are probably the most common types you'll see in a medical setting and most simple to diagnose and treat. So it's important to understand, recognize, and properly assess the heart's different rhythms that is possibly could save somebody's life. If you ask me, I think the heart is by far one of the most is probably the most important organ in the body. I hope I've maybe inspired you to learn more about EKG strips, the heart, or even go get ACLS certified and continue learning about patients with these life-threatening arrhythmias. Who knows? You could be the patient. Bye. Stop.